Tinnitus is the perception of noise or ringing in the ears when no external sound is present. It is not a condition itself but rather a symptom of an underlying condition, such as hearing loss, ear injury, or a circulatory system disorder. Tinnitus can be temporary or chronic and can vary in intensity and type. Types of tinnitus: subjective tinnitus. This is the most common type and can only be heard by the person experiencing it. It is often related to hearing loss and can be caused by various factors, including exposure to loud noises, ear infections, or age-related hearing loss. Subjective tinnitus. This rare type can be heard by an examiner during an examination. It may be caused by blood flow in the vessels near the ear or muscle contractions. Symptoms: the primary symptom of tinnitus is the perception of sound in the ears or head, which can include ringing, buzzing, hissing, clicking, roaring. The sound can vary in volume and may be constant or intermittent. Tinnitus may be present in one ear or both and can sometimes be associated with hearing loss. Causes: tinnitus can result from a wide range of factors, including hearing loss, age-related hearing loss, presbycusis or noise-induced hearing loss is among the most common causes. Ear conditions: earwax buildup. Excessive earwax can block the ear canal and lead to tinnitus. Ear infections. Infections can cause inflammation and fluid buildup, affecting hearing and causing tinnitus. Otosclerosis. The condition where the bones in the middle ear become stiff, leading to hearing loss and tinnitus. Exposure to loud noises. Prolonged exposure to loud sounds, such as music, concerts, machinery, or gunshots, can damage the hair cells in the inner ear and lead to tinnitus. Head and neck injuries. Trauma to the head or neck can affect the auditory system and lead to tinnitus. Medical conditions. Conditions such as Meniere's disease, acoustic neuroma, and certain cardiovascular disorders can be associated with tinnitus. Medications. Some medications, particularly ototoxic drugs e.g., certain antibiotics, chemotherapy drugs, and high doses of aspirin can cause or worsen tinnitus. Stress and anxiety. Psychological factors such as stress, anxiety, and depression can exacerbate tinnitus. Diagnosis. Diagnosing tinnitus typically involves medical history and physical examination. A healthcare provider will take a thorough medical history and perform a physical exam to understand the symptoms and any underlying conditions. Hearing tests. Audiometry tests can assess hearing loss and determine the nature of the tinnitus. Imaging studies. In some cases, imaging studies like MRI or CT scans may be ordered to rule out underlying conditions such as tumors or vascular issues. Treatment. There is no one-size-fits-all treatment for tinnitus, as the underlying cause varies from person to person. Treatment options may include addressing underlying causes. If tinnitus is caused by an underlying condition e.g., earwax buildup, hearing loss, treating that condition may alleviate symptoms. Sound therapy. Using white noise machines, hearing aids, or other sound-generating devices can help mask the tinnitus sounds, making them less noticeable. Cognitive behavioral therapy. CBT therapy can help individuals manage the emotional response to tinnitus, reducing anxiety and improving quality of life. Tinnitus retraining therapy. This approach combines sound therapy with counseling to help patients habituate to the tinnitus sound and reduce its perceived intensity. Medications. While there are no specific medications to treat tinnitus, some may be prescribed to help with associated symptoms, such as anxiety or sleep disturbances. Lifestyle modifications. Reducing caffeine and alcohol intake, managing stress, and practicing relaxation techniques can help manage tinnitus symptoms. Coping strategies. Living with tinnitus can be challenging. Here are some strategies to cope. Stay informed. Understanding tinnitus can help reduce anxiety and improve coping skills. Join support groups. Connecting with others who experience tinnitus can provide emotional support and coping strategies. Limit exposure to loud noises. Protecting your ears from loud environments can help prevent worsening symptoms. Use background noise. Soft background noise like a fan or soothing music can help distract from the tinnitus sound. Conclusion: tinnitus is a common and often distressing condition that can significantly impact quality of life. While it can arise from various underlying causes, understanding the condition and seeking appropriate management can help individuals cope with and alleviate symptoms. If you experience persistent tinnitus or notice changes in your hearing, it is essential to consult a healthcare provider for evaluation and management options.